Ben Bradley.
Mr Deputy Speaker, pleasure to speak in this debate. I'm going to try and skip some of the partisan rhetoric and perhaps get to the crux of some of the issues involved in this. But I will start by thanking my honourable friend from Newcastle-under-Lyme for raising the point of PFI, because I also represent a hospital that I think, last time I checked, spends 14% of its annual budget repaying Labour's PFI deal, which is absolutely incredible and a detriment to all of my constituents, although it is a lovely building, I will say. This workforce question is really important, Mr Deputy Speaker, and we all know we need happy, healthy staff in our NHS, in our wider health services. They have untold pressures on them as it stands, from COVID, from the cost of living challenges, from short staffing in departments. Absolutely, we all understand that. But I think my message to the Shadow Minister opposite might be that saying that and saying that we want things to be better is not a plan. It's a nice thing to talk about, but it doesn't actually fix anything. And the motion is actually a little bit misleading. It doesn't mention that we have 37,000 more doctors and 45,000 more nurses and record levels of recruitment, record staff numbers in our NHS. Truth be told, we have shortages in everything around our economy, Mr Deputy Speaker. We've got a debate on the economy a little bit later. A lot of this could transfer over into that because we have a wider challenge, particularly about economic inactivity, actually, in getting people into work that impacts on all of this. This is a much bigger systems and process question than just about chucking resource in at one end and adding more training courses. That will not fix this issue. We've got record funding in our NHS, we've got record levels of staffing, and this government has taken lots of action to try and increase it. The bursary has been mentioned, the nursing bursary, and people often talk about reduction in applications, but what they miss or perhaps neglect to mention is that it led to an increase in actual people doing actual nursing courses because it removed the targets, it removed the lack of funding in the system, it enabled more funding to flow into